Last Friday's Supreme Court decision to overturn Roe v. Wade continues to face backlash in the form of protests and a wave of litigation across the U.S. Much of Monday's court activity focused on trigger laws, which have been adopted in 13 states and were designed to take effect swiftly after the ruling. Overall, 26 states are certain or at least likely to fully ban abortion. Well, joining us now to talk more about the overall impact of abortion bans is Dr. Liza Fuentes, senior research scientist at the Guttmacher Institute, specializing in the evaluation of abortion restrictions. Dr. Fuentes, welcome to Forum Daily.
Hi, thanks for having me.
Now, your organization points to decades of research, which indicates that abortion bans and restrictions don't actually reduce unintended pregnancies or the overall demand for abortion. So what can these restrictions lead women to do in such situations?
When people are seeking abortion care in highly restrictive places, as many states in the United States are, and now that Roe versus Wade is overturned, even more so, or they have to travel very far to even find a clinic that offers abortion care. And in those cases, we see several outcomes. First, people already struggling to make ends meet have often delayed care because it takes time, sometimes weeks, to gather the money and resources like childcare and transportation to even attend an appointment. And those delays add costs. And even though abortion is extremely safe, added risk, because every further along a pregnancy gets, the more expensive it is, and there are some minor risks that accrue. Second, we also may see some people who are struggling to afford abortion care to forego an abortion altogether, because as they are working to obtain care, they time out and are unable to obtain an abortion at all. This means involuntarily taking on the added risks of pregnancy. Continuing a pregnancy is more dangerous than an abortion, and an abortion is safer, even safer than riding a bike. Finally, some people who cannot afford to travel to a clinic may try to self-manage an abortion, for example, by obtaining medications for abortion without the help of a clinician. And while self-managed abortion with appropriate medications is very safe, now that Roe is overturned, we fear that people who choose to self-manage abortion are at greater risk of being involved with the criminal justice system, or maybe perhaps people who help them, with people living with low incomes, immigrants, and people of color most at risk for that.
And Guttmacher also highlights the impact of forced pregnancies. So can you tell us a little bit more about your research into this?
Sure. Our research is grounded in advancing the ability of everyone to decide whether, when, and how to become pregnant and become a parent. So to that end, we have found that the vast majority, if not all, legal restrictions on abortion in the United States are not grounded in any medical evidence, do not improve safety, and do not ensure high quality care, but rather they impose added costly barriers that can sometimes end up denying people care altogether. And as I said, imposing delays, even if they do obtain care, thereby denying pregnant people and their families the ability to care for themselves, and often the children they have. And it's notable that our research shows that 60% of people seeking abortion care are already parents. And abortion patients note being able to take care of the children they already have as one of the reasons for seeking abortion care.
And a lot's happening down in the United States. We know the midterm elections are upcoming, and lawmakers are discussing supports for vulnerable mothers and children. So staying on that point, what do we know so far about current social programs for such demographics?
Yeah, well, states that have sought to highly restrict abortion and now are looking to ban abortion are the states that often have the worst maternal and child health outcomes, and have the most flimsy and thin social programs to support people with regard to things like paid parental leave and other social programs. And just for a case in point, in the case that was just argued and decided to overturn Roe, Dobbs versus Jackson Women's Health Organization, that case was originated in Mississippi that wanted to ban abortion at 15 weeks, and they rank 50 at this in maternal mortality. So they're really the correlation between banning abortion and restricting abortion and social safety networks and maternal and child health is inverse. And so we really don't find evidence that states that are looking to ban and restrict abortion are motivated to support the health and well-being of families and children.
All right, Dr. Fuentes, a quick 45 seconds left here, but there are concerns around unsafe and illegal abortions. You spoke a little bit more about that, or a little bit about that earlier in this interview. Tell us a little bit more about these procedures and how they impact maternal deaths.
Well, I know we only have 45 seconds, but I'll just say that today having Roe overturned is different than before Roe. We have medication abortion. It's incredibly safe. And we know that when people are given the proper instructions, they know how to use it. That's not to say that there will be some people who may try other methods that are less safe. And likely what will happen is that they won't be able to successfully have an abortion. And we may see some people who may end up harmed. But with medication abortion, we hope to mitigate that because self-managed abortion with medications are, in fact, very safe. But overturning Roe may have other impacts on maternal deaths through other mechanisms, such as intimate partner violence and complications during pregnancy. That would be an unfortunate, terrible outcome of overturning Roe.
All right, Dr. Fuentes, thank you again for joining us today on Forum Daily.
Thank you.
We'll be right back.